So Alveofit is a digital healthcare company on a mission to make a respiratory care affordable and accessible. As Mr. Arvind rightly said, making into a not only in a primary care, but it's primarily make a part of care, because if we look at the overall the disease load across India, or not in India but globally, these are the population which are diagnosed with a respiratory condition. Think about the population which is not having a modality as of now today, or if you look at the Indian subcontinent where uh, this is spirometry is we would say the gold standard test to understand what kind of respiratory function related issues they are having. They have obstructive asthma, ILD, ALS, or restriction, severe restriction. But uh, this we are able to achieve only till now if you look at the tertiary care hospital or a super specialty clinic or a well-known clinical setting where this modality is available. What about the population currently residing into tier 2, tier 3 cities or a rural part of India? Because uh, two factors, this respiratory function or pulmonary function test is either by the technicians or there is a lack of specialty to understand or to interpret these results. Number one. Number two is uh, since these devices are so costly in nature to measure the lung function, generally ranges from 4 lakh rupees to 8 lakh rupees or 10 lakh rupees. So once if I have a clinical setting, do I need to deploy these kind of machine to generate a ROI in a private setting, or in a government setting? Are we able to invest at that large scale? Because being as the Indian public health infrastructure is so vast, if we need to deploy these machines to each and every sub center or primary care centers, the majority of the chunk will going into just investing into the one specialty. So we were on a mission that why this particular modality is so costly, let's make it so affordable. So we went back and we invested hugely heavily, that we are able to develop a very small handheld spirometer at very low cost, highly clinically accurate, validated and patented. Because in the previous, people have said that it has to be clinically relevant, clinically validated, and widely accepted by the clinical fraternity. But even if it is a small solution, are we able to produce the results? Yes, we are able to produce the results. So by deploying at that large scale, we were able to screen a good number of patients, and we found that prevalence that is being reported today, it's half of it, or I would say one third of what we are currently looking at. But the actual population is at very large scale, which has to be properly screened. And respiratory pulmonary function test has to be a first line of a patient intake going forward. Now once patient is identified with a particular disease, how we and we started the clinical protocols. But respiratory conditions are chronic in nature, which require continuous monitoring and continuous care, because these populations are having a two buckets, one which is on SOS medication, another one is on a regular medication. Once patients start feeling much more relief from that particular treatment, so he move away from the treatment, but there are underlying inflammation is still there. So a patient has to properly screen over the period of time. And just because of nature of this test and the cost currently so high, so physicians are not writing the stats. If you look at the tertiary care hospital is costing 3,000 rupees in India, but as a Alveofit, we are able to reduce this cost into 1/20th of the actual cost. So we can take this technology to every place and every corner clinic. We want to massify it, so whoever is want to go get a screen properly monitored over the period of time, frequently monitoring can happen. Now if it is being monitored, it being cared, is delivered. So by doing so, currently what is happening in Indian healthcare system, dependency on inhalers are increasing. but that is not the right solution. We want
5 minutes
to,
to code activation.
yeah, we want to move away from reducing dependency on the inhaler therapy. So we have to introduce a proper mode of rehabilitating the patients, and how we quantify it using the technology. If how we are able to quantify what is patient lung function, are we able to improve it, we should able to track that overall progress. We as a Alveofit, we are moving from traditional healthcare. Currently, we are living into the digital healthcare era, but we as a Alveofit believe it has to be much more connected, much more coherent. We need a real-time feedback when patient is diagnosed, as patient is being deployed to a treatment protocol, because uh, care currently care is delivered at the tertiary care unit, or at the hospital or within a clinic, but we need to reach, given that nature of disease, beyond the institutional boundaries. So this care can be delivered at the home, patient being at home able to monitor his lung function, able to adhere to a much more a comprehensive care plan, and the real-time feedback given to the care provider who are associated and responsible to deliver the care. Now, being as a be at a Alveofit, we were able to, you know given that nature of this particular test, we were able to generate the quality reports now at so low cost. Now, with respect to interpretation, we have deployed our machine learning technology, so we can interpret whether patient uh, and whether patient is having what kind of symptoms, whether obstructive or restrictive, and the grading of those test results. Classic example is currently we have one deployment in Jansa Sahyog, which is a very remote facility in Bilaspur, where this particular, there were technicians were not aware about how to conduct the pulmonary function test, but using Alveofit, no much training is required, no such a detailed clinical interpretation or understanding is required, because our devices and our machine learning algorithms are self-sufficient to produce a much more quality data that can be taken into a clinical interpretation. And we were able to make a significant dent into that particular region, because who they have deployed this program into a vast scale, and whoever walks into their clinical setting is now able to have a screen through our LVFX ecosystem. So I'll put a full stop here and hand over to Shantanu.